There is this protracted problem of medical interns and other medical officers striking almost every year. Are you planning to have a lasting solution to this kind of problem?
There must be some way of either limiting the number or increase the money, because but the two are not matching together. But finance also came back and wrote to us and said, sorry, we don't have money. First of all, we don't have this money that keep on changing every year. Right now I need 80 billion for the next financial year to pay interns and all SHOs. And finance said they don't have the money.
The senior house officers who supervise the medical interns, they are saying that they have not received their allowances for 6 months. What's the plan?
So from 300 to 800, that's a big number difference with a limited amount of money. Remember, that money we had in this budget was appropriated in the other last year. So we have presented this dilemma to the Parliament, the Committee of Parliament that appropriates money. We have presented this to Minister of Finance, and it is one of also the things we are going to discuss when we go to Cabinet.
Don't you think it's because of poor planning that you're overwhelmed by the numbers that you admit but you can't pay? Ideally, you should be knowing how many students or how many of those officers are going to be coming to the facilities, and then plan in advance with Ministry of Finance, other than handling a crisis every year.
I agree with you. And I think that effort was made. I remember I wrote a letter to all university vice-chancellors about 4 years ago, that when they admit, they give us names. Because you see, when, for example, now, I should have known the 5th years now. I shouldn't have known the numbers. Or the SHOs now in first year, no, like the year to come. I should have known how many each university is going to, to admit. And then I get that number early, then we incorporate that into our budgeting process, so that then the money appropriated is in line with the number that we have. But that does not happen. 4 years when I wrote to the vice-chancellors, I never received even one letter like this.
What do you think is ideal? Continue admitting what you can't afford to pay, or completely improvise means of ensuring that you only take up or you bite what you can swallow?
When I was doing my M.Med for 3 years in Mulago, I told you, for us who are not paid, just we started paying recently. So it's not something that is outrageous that it can, SHOs actually can work without, it is very possible. But our worry was the interns, because these interns, when they go to work in hospitals and they work up to late hours, then they have to move out, then they have to, because of the numbers, for us when we were doing internship, the numbers were small, were housed in the hospitals. But now the numbers are so big that they cannot be housed in the hospital. So they need to be housed somewhere. So if they don't have money to pay for their feeding, for their transport, for their accommodation, it gets harder for them.
These medical officers who are on strike, they contribute entirely to the service delivery in these hospitals. How are you planning to deal with this crisis?
We shall continue to engage them, to listen to them. If we be able to tell them and then they are able to listen and they go back, well and good. If they are not, then we'll have to decide as government. So still a decision will have to be made.
There's been an exhibition online, Twitter, where people have been saying so many things happening within the Ministry of Health, reporting different stuff that have been swept under the carpet, and they are unraveling. And the complaint is that the Ministry of Health has been adamantly refusing to respond or give a clear way forward. What's the plan?
Ministry of Health is one of the ministries that communicates. You know very well. Anything we do, any complaint, that's why we have a full-fledged call center here, 24/7. Even at night, if you have a problem and you call, they will follow up and they address the issue. So these issues that are coming up from different people have been followed up, except that we may not have the time to sit on Twitter. Now this one has complained that Adjumani or someone, but that one, surely, I don't know, I'm not accounting office of Adjumani. So you advise, thank you very much, contact Adjumani accounting officer to make sure that issue is addressed. That one, it doesn't require a statement. Do I need to sit down and now, or you put a picture, someone is on the veranda of Cancer Institute, the patients are men. And we have always been sharing, you've been running those stories, how cancer has increased, how we are educating people to prevent diseases, to reduce the overflow and what. We are increasing capacity. If you go to Cancer Institute, if you remember the Cancer Institute of 5 years ago and now, a lot has changed. We have expanded, we have put bunkers, we put linear accelerators, we put brachytherapy machines, you know. So the services are improving. But you see, because of the numbers, you find the attendant have nowhere to sleep. They will go on the veranda, even the patient. So now, how will I answer now that one? Thank you.